have all been identified and isolated so that they don't, they don't contract or they don't continue spreading the illness, so they are under our care. The sick have been identified and also put in treatment centers, and they are receiving the treatment. But also to enhance prevention further, we have gone ahead to vaccinate our staff, especially those ones that are had contacts, and we have given them the trial drug, but we know that it is safe because it had gone through the first phase. So we want to make sure that we are putting all measures in place to make sure that all our affected people are protected, are treated, and get out well. The other capacity that we have been built over many years is the laboratory capacity. Before, it would take us many hours, days to get results. Right now, we brought in the mobile lab. It's right here in the hospital, and it can, within 6 hours of receiving the sample, it is able to provide the results so that we are able to respond quickly. The other thing, we came here also to tell the public that there is no need to panic, because once they hear this word of panic, they can even run away. But we want to tell the public is that we are in charge, and we have made sure that we get everybody who was at risk or who got in contact with the patient with us, so that people should continue doing their routine. They shouldn't fear, but they should make sure that they are alert in case they see anyone who exhibits those symptoms that the minister talked about. They should also report. We also want to assure the international community that Uganda has got also capacity to contain this illness. Like before, we have contained it even in the shortest possible time. We believe also this one we shall contain in the shortest possible time. We have deployed our people at the border points, make sure that we continue screening and we don't allow anybody who is suspected to be sick to go out, because we have never imported the epidemic to our neighbors, and we will continue also to safeguard not only the population of Uganda, but also to safeguard our neighbors. The same thing we have done at the airport. We are working with our partners to make sure that we bring all the supplies that are necessary, the supplies, the vaccines, the treatment, the supplies to protect our people who are treating our patients in isolation, and also to make sure that also the continuation of services in our hospital and our facility continue uninterrupted. But I wanted also to say that we have also established that among the Bamasaba, there is a group that eat bats. And this one is a delicacy, and bats is a home for Ebola virus. Ebola virus has been found when the surveillance was done. We found that it can be found in bats, it can be found in monkeys, it can be found in those animals that stay in the forest. So we ask the population here, if we still have that group of people that take bats as delicacy, we want to remind us that those bats could be continuously a danger, not only to you who is eating them, but also to your family, and also to entire community and the country. Every time we get this kind of epidemic, it affects us, it affects our workers because they are stressed, and it requires a lot of resources to control. Therefore, by their, I wouldn't want to call it irresponsibility, but by their practice of eating bats, it could put entire country in danger. Therefore, I think we can look at other options for now to eat,
Yes.
We can eat other things, or they can rear chicken at home, they can rear, goats, and if they want to eat, or they can have even fish ponds so that they keep fish. Any animal protein can be good, other than getting the animals in the forest that actually are known and well documented that they harbor the birds. So please, we just want to remind the population that let us resist from doing this. Thank you very much.
Thank you, Dr.